Fever is one of the most common reasons parents bring their child to a doctor. Almost all parents worry when their child develops a fever, but the most important thing is knowing what to do when it happens. When approaching fever in children, one of the most important factors is the child's age. For babies under 1 month old, any fever is considered an emergency. Parents should bring the baby to a doctor immediately without hesitation. At this age, fever can sometimes lead to serious and potentially dangerous complications. For babies older than 1 month and up to around 3 months, there is still some risk, although it is lower compared to newborns. At this stage, parents should pay close attention to warning signs, also known as red flags. These warning signs include severe lethargy or unusual sleepiness, poor feeding or refusal to breastfeed, breathing difficulty or respiratory distress, low muscle tone, where the baby feels unusually floppy, bluish discoloration of the lips or skin. If any of these signs are present, parents should go to the emergency room right away. Even if these warning signs are not present, it is still best to see a doctor at this age. The cause may be something mild like a viral infection that can be managed with acetaminophen, or it could be a bacterial infection that needs antibiotics. That's why medical evaluation is important. For children between 3 months and 3 years old, vaccination history becomes very important. If the child has no warning signs, looks generally well, and is fully vaccinated, parents can usually monitor the child for 2 to 3 days while controlling the fever with acetaminophen. This is especially reasonable if the child has a simple cold or mild vomiting and diarrhea, since most infections at this age are viral and do not require antibiotics. We'll talk more in future videos about how to manage these common illnesses at home. However, if the child develops warning signs, or if the fever does not improve with the correct dose of acetaminophen or ibuprofen, parents should see a doctor. At this age, the child's overall condition matters more than the fever itself. Parents do not need to rush to the emergency room every time their child has a fever. The first step is learning how to manage fever properly using the correct dose of acetaminophen. Then, if the fever lasts longer than expected, does not respond to fever-reducing medicine, or the child's overall condition worsens, medical evaluation is necessary. This is especially true because infections involving the digestive system or respiratory system are often viral. So when it comes to fever in children, there are 2 key things parents should always remember. First, the child's age. If the child is under 3 months old, fever should always be taken seriously and evaluated by a doctor. For older children, it is often reasonable to monitor them for 2 to 3 days if they are otherwise doing well. Second, warning signs. These include the child looks very ill or unusually weak, poor feeding or reduced fluid intake, difficulty breathing, seizures, neck stiffness, persistent vomiting, reduced urination, bloody diarrhea or vomiting. These are important signs that indicate parents should seek medical attention as soon as possible.